Managing fluids for the adult in shock. Shock is normally treated with a large volume of IV fluids given rapidly. This video will show how to assess and safely treat an adult in shock. Wear gloves and a mask when working with sterile equipment, blood, and bloody fluids. First, determine whether the patient is in shock. Check for cold hands, a fast and weak pulse, and slow capillary refill. Call for help.
I need some help, please. Some help. Yes, can I help?
Assess the patient as your colleagues insert IV cannulas and start oxygen. Assess for the 3 conditions where fluids must be given cautiously. First, severe malnutrition. Is the patient extremely thin? Second, severe anemia. Is the patient's palm very pale compared to your palm? Third, fluid overload. Check the chest for the most sensitive signs: fast breathing and crackles in the lungs. If the patient in shock has no signs of severe malnutrition, severe anemia, or fluid overload, give 1 liter of normal saline or Ringer's lactate as fast as possible, over less than 30 minutes. Squeeze the bag of fluid in your hands or wrap a blood pressure cuff around it and inflate the cuff until the fluid is running continuously. Cover the patient for warmth. Immediately after the patient receives the liter of fluids, check pulse and capillary refill to see if the patient has continued signs of shock. If he is improving, the pulse rate will lower and the capillary refill will be quick. Assess the patient periodically for signs of fluid overload. Observe for fast breathing and listen to his lungs for crackles. If he is still in shock and has no signs of fluid overload, give another liter of fluids quickly. If the adult in shock is severely malnourished, give fluids by mouth. If he is unable to drink, give IV fluids with added dextrose at a slow rate. Monitor the patient closely for signs of fluid overload. If the adult in shock has severe anemia or signs of fluid overload, they still need IV fluids, but give small amounts slowly. Monitor the patient for signs of fluid overload. Give a blood transfusion to treat the anemia. If signs of fluid overload develop, stop IV fluids. The patient will have fast breathing and crackles in the lungs. They may breathe easier sitting up, have distended neck veins, swollen feet, and cough pink, frothy sputum. Remember, patients in shock need IV fluids rapidly. Be cautious giving fluids in patients with severe malnutrition, severe anemia, and fluid overload.